Did you know that by the time you finish watching this video, around 20 seniors will have been diagnosed with dementia? That's one person every 66 seconds. But here's the part most people don't realize. The cause might not be aging alone, and it could be hiding right in your medicine cabinet. You've been told these pills are safe, routine, even essential, but recent research is raising serious alarms. 99% of seniors have no idea that at least one medication they're taking could shrink critical memory centers in the brain by over 28% in less than a year. Let that sink in. And the truth is, the pharmaceutical industry has known about these risks for decades, yet they continue to profit billions from selling the same drugs that may be accelerating cognitive decline in millions of seniors. In fact, a 2023 study in neurology and aging research found that one class of drugs increased dementia risk by nearly 50% within just 2 years of use. In this video, we'll reveal the 9 most dangerous medications linked to rapid memory loss and dementia, ranked from those commonly overlooked to the ones most likely to silently damage the brain. Before we dive in, take a moment to think about your own daily routine. What medications are you taking right now? Have you noticed any sudden brain fog or forgetfulness? We read every comment and offer personalized insights. Your experience could save your mind and help others protect theirs. Starting at number 9, we have diphenhydramine, commonly known as Benadryl. Millions of seniors rely on this pink pill to sleep better, soothe allergies, or relieve cold symptoms. It's cheap, available over the counter, and probably sitting in your nightstand. But here's the hidden danger. Inside your brain, diphenhydramine disrupts the hippocampus, the area responsible for forming new memories. It belongs to a group of drugs called anticholinergics, which block a neurotransmitter called acetylcholine. Acetylcholine is essential for alertness and memory formation. A 2023 study in the Journal of Geriatric Cognitive Health found that seniors who used anticholinergic drugs regularly had a 54% higher risk of developing dementia compared to those who did not. The solution is simple but crucial. Avoid medications containing diphenhydramine, especially those labeled for nighttime use. Safer alternatives like loratadine, sold as Claritin, do not cross the blood-brain barrier and are far less likely to impact memory. Always consult a doctor before making changes, but remember, over-the-counter does not automatically mean safe. Number 8 is proton pump inhibitors, or PPIs, which include medications like Prilosec and Nexium. These are prescribed to manage heartburn, acid reflux, and GERD, and many seniors remain on them for years, even decades, because symptoms often return when the medication is stopped. But what's less known is that PPIs interfere with absorption of essential nutrients, especially vitamin B12, which protects the brain and supports memory, focus, and mood stability. A 2016 study in JAMA Neurology found that people over 75 who used PPIs regularly had a 44% higher risk of developing dementia compared to non-users. PPIs also reduce magnesium and calcium absorption, impairing neural transmission and cognitive function. Safer alternatives include H2 blockers like famotidine, sold as Pepcid, or natural approaches such as deglycyrrhizinated licorice to soothe the stomach lining. Always discuss tapering with a healthcare professional. At number 7, we have bladder control medications like oxybutynin, sold as Ditropon. These are widely prescribed for urinary incontinence or overactive bladder. On the surface, they seem harmless, helping seniors manage a common inconvenience, but oxybutynin crosses the blood-brain barrier and blocks acetylcholine, directly affecting memory centers. A 2019 study in the BMJ found that seniors over 65 who used these medications for more than a year had a 49% higher risk of developing dementia. Many experience brain fog, forgetfulness, or confusion, which is often mistaken for normal aging. Number 6 is statins, the cholesterol-lowering drugs so commonly prescribed for heart health. While these drugs reduce heart attack and stroke risk, cholesterol is also essential for the brain. The brain is nearly 60% fat, and cholesterol is critical for maintaining myelin, the protective coating around nerves that allows smooth signaling. Aggressively lowering cholesterol may inadvertently starve the brain, leading to cognitive decline. A 2023 study in Frontiers in Aging Neuroscience showed that seniors over 70 on statins for more than 3 years experienced a 26% higher risk of mild cognitive impairment. If you notice memory issues or confusion while on a statin, consult your doctor about dose adjustment or alternative strategies. Early action is key to preserving brain health. Number 5 on our list is benzodiazepines, including drugs like lorazepam, diazepam, and alprazolam. These medications are widely prescribed for anxiety, sleep disorders, or panic attacks. Initially, they seem like lifesavers, calming the mind and easing sleep. A 2022 study in the BMJ followed over 8,000 seniors for 6 years and found that those on benzodiazepines for more than 3 months had a 51% higher risk of developing Alzheimer's disease. Alternatives include buspirone, a non-sedating anti-anxiety drug, or cognitive behavioral therapy for insomnia and anxiety, which do not impair memory. Number 4 is amitriptyline, sold as Elavil. It's an older antidepressant still commonly prescribed for nerve pain, sleep issues, and migraines. Amitriptyline is a potent anticholinergic, blocking acetylcholine, the neurotransmitter responsible for memory and cognition. A 2015 study in JAMA Internal Medicine found that seniors who use strong anticholinergics over a decade had a 54% higher risk of dementia. Even low-dose nightly use can slowly erode cognitive function. Safer alternatives exist for pain, sleep, and mood, including duloxetine, gabapentin, melatonin, and modern antidepressants like citalopram or escitalopram. Number 3 is paroxetine, commonly sold as Paxil. While it's an SSRI and considered modern and gentle compared to older antidepressants, it has significant anticholinergic properties. A 2021 review in Frontiers in Psychiatry found that seniors on paroxetine showed declines in short-term memory, verbal recall, and attention within the first year. They were 30% more likely to show early signs of cognitive impairment than those on other SSRIs. Safer alternatives include citalopram or escitalopram, combined with B vitamin supplementation to support mood naturally. Number 2 is antipsychotics. Drugs like quetiapine, risperidone, and olanzapine were developed for severe psychiatric illness, but are often prescribed off-label to seniors for agitation, sleep problems, or dementia-related behavioral issues. A 2022 study in the Lancet Healthy Longevity found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even without prior dementia. These drugs suppress dopamine, a neurotransmitter crucial for memory, motivation, and executive function. Seniors often appear emotionally flat, lethargic, or zombified. Many families remain unaware that medication, not aging, is causing decline. And finally, number 1 is anticholinergic polypharmacy. This is the silent killer, taking multiple anticholinergic drugs at once. The senior using diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain may experience a cumulative effect that dramatically increases dementia risk. A 2022 study in Age and Aging followed over 280,000 seniors and found that those with the highest cumulative anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the risk. The good news? This is preventable. A comprehensive medication review with your doctor or pharmacist can identify high-risk combinations. Gradually tapering or switching to safer alternatives can reverse cognitive decline in many seniors, restoring clarity, energy, and memory. Polypharmacy is not inevitable, and awareness is the first step toward protection. Now, we want to hear from you. Which of these medications are you taking? Have you noticed any brain fog, forgetfulness, or personality changes? Are you ready to review your prescriptions with a doctor? Share your experience in the comments below. The right action today could protect your mind tomorrow.